Welcome to the Endo Belly Girl podcast. I'm your host, Alyssa Chavez. I'm a nutritional therapy practitioner and restorative wellness practitioner on a mission to change the way that we support women with endometriosis. Endo is a full-body disease that impacts your mind, body, and spirit in countless ways that aren't often addressed the way that women truly deserve. We are here to talk about all of it. Please keep in mind that the content of this show has been created for educational purposes only and should never be used as a replacement for medical diagnosis or treatment. Hey, my friend, and welcome back to the Endo Belly Girl podcast. Today, I have a special guest for you. Her name is Dr. Danielle Owens. She is a pelvic floor physical therapist, and I actually met her at an in-person event in San Diego area and just really resonated with what she was saying, really connected with her. And so I wanted to bring her onto the podcast so you all could get to know her as well. She just does some fantastic work with women and really helps people who are struggling with endometriosis and other pelvic health type dysfunctions. And I just love what she has to say because, of course, on this podcast, we talk a lot about all things nutrition and supplements and lifestyle and all the things to help to support our bodies. But sometimes we just need some physical support as well. And Dr. Danielle Owens is going to walk you through what that really looks like and how you can find support for yourself and how pelvic floor physical therapy can be helpful for endometriosis in particular. So Dr. Danielle Owens is a doctor of physical therapy, and she works in San Diego at her own clinic as a pelvic floor physical therapist and really enjoys working with all types of different women. She does work with women with endometriosis. She does a lot of work with prenatal and postnatal care as well, which is so incredibly needed. And she absolutely is very passionate about what she does. And I am so excited to have her share with you all today. So without further ado, I will let Danielle take it away. All right. Well, hi, Danielle. Thank you so much for being here today. I am super excited to chat with you and for everybody to get to know you a little bit. So thank you for taking the time to be here today.
Of course. My pleasure.
Yeah. Well, I would love if we can start off just by getting to know you a little bit. So can you share a little bit about who you are, what you do, how you came to be doing what you're doing, all the things?
So I'm a pelvic floor physical therapist. Interestingly enough, they gave us like a 1 hour long lecture on women's health and pelvic floor therapy in PT school, which is kind of crazy. So I graduated school, got my first job. It was just like a general ortho clinic. And I got really bored because it was all just, chronic pain patients who weren't really all that interested in getting better. So it was really burned me out. So then I said, you know what, I need to figure out like a niche thing I can do that's going to be more fulfilling. So I remembered, pelvic floor, women's health PT, and I took a whole bunch of courses to get certified so that I could, competently treat these patients. And then I started doing it and I just really loved it. So I've been doing it ever since for like the past 5 years.
Amazing. Well, it's definitely something that's so needed. I mean, there's so many women who need that kind of support for different reasons.
There's not enough.
Absolutely. And of course, since my listeners here are primarily women with endometriosis, we're going to focus around that today, but I know that you work with patients who have all kinds of things going on. Can you just share a little bit about kind of the different populations that you work with, different groups that you work with? Because you never know who might know somebody too, who might need pelvic floor PT in other areas.
Yeah, so I do a lot of prenatal and postpartum care. So prenatal, I teach them birth prep, how to deliver without tearing, how to just stay strong during pregnancy. And then postpartum, I treat any of the slew of things that could be going on afterwards, like diastasis recti, leaking, which is incontinence, pelvic pain, back pain, hip pain, and anything like that. Then I also treat many pelvic pain conditions such as endometriosis, interstitial cystitis, vaginismus, low back pain, SI joint pain, patients going through perimenopause and menopause. There's a lot of things that go on with the pelvic floor as you're going through that stage of life due to hormonal changes. Leaking and pain are big ones.
Yeah. Yeah. So many things that you can support. I love that. Well, let's dig in a little bit to what that really looks like when you are supporting someone who has endometriosis. So, what are just some of the common things that you see, common symptoms that women are coming in with that you would be supporting them on?
So, of course, there's the classic, upper pelvic abdominal pain that come from the fibroids. So, there's visceral massage and manipulation that you can do on their abdomen to try and break up not only the adhesions that form from the fibroids, you can almost get into the fibroids a little and then just release the tissue and fascia in the core that becomes tight with this condition. Also, with the chronic pain response, when your body is constantly in pain, it's causing muscles everywhere to tighten up, specifically your jaw, your upper traps, and your pelvic floor. They're all part of the fight or flight response or the sympathetic nervous system. So whether you realize it or not, those muscles are clenching up over and over and over again. So in the pelvic floor, that can present with just random pelvic pain you get with certain activities, pain with sex in particular, even just inserting tampons. So there's stretching and manual therapy that you can do to help patients with those symptoms as well.
Yeah, I love how you're talking about how that tension can kind of present itself in different areas, because of course we tend to think about, okay, I've got that pelvic pain and that's the area that we tend to focus on. But I love that you're talking about the tension in the jaw and the upper body too, and how that can connect. Can you share just a little bit more about that and what that looks like, how that really connects with the, period pain somebody might be experiencing?
Yeah, so the body, along with muscles and nerves, has a whole fascia system that kind of covers the muscles. So really, when they say everything's connected, it really is. But particularly with the jaw, the traps, the upper traps, like between your shoulders and your neck and your pelvic floor, they just tend to, it's part of like your central nervous system. They just clench up as like an automatic response almost. So they get tight over and over again. It also, with the period pain, a lot of the endometriosis pain will refer to like the low back or even your hips. So that's something that can be addressed as well.
Yeah, so interesting. I've always been so fascinated by fascia and just how interconnected everything in our bodies are. For anyone who might not be familiar with what that means, like what is fascia and how does that impact the way that your body feels?
So fascia it's basically like a layer of connective tissue that goes over all of the muscles and kind of keeps everything together. So it's all over your entire body. So it's like a wetsuit almost that goes over your muscles.
Yeah. I that's one thing that I just feel like is so interesting and so many layers to that as far as just how it interconnects everything in your body. It's something that I've definitely explored a lot through my life in different ways, but I absolutely love exploring how our bodies are so connected. And it's something, of course, that we talk about in the work that I do too, just how the body systems are connected, that nothing really works independently, but that's also true with our physical muscles that, we may have pain in one region of your body, but it doesn't mean that that's the only place that we would focus on, that you want to really support the whole entire body, the whole system. So I love that you have that approach.
Right. And there's also something called referred pain where you have a
Yes.
fibroid like on your uterus. You're not going to be able to feel that it's on your uterus. It's just not really something that you're mentally aware of. So it will refer elsewhere, like your pubic bone area, your hip, your groin, even your low back.
Yeah. Yeah, absolutely. And that's the part I think can be a little frustrating and confusing for people too. Like, why is pain popping up in that spot? Like, this is something that I've seen recently in my practice with a couple of my clients, is even having shoulder pain that's popping up. That seemed, to them is like, this seems like completely random, but I can absolutely see how that can happen where it just refers out to other areas of your body. Do you see that a lot where you see pain popping up in different areas?
Yes. So the abdomen is separated into 4 quadrants: the right upper, right lower, left upper, left lower. And depending on where the pain is originating, if it's pressing on like a nerve or something, Sometimes it will refer up to the shoulders,
Mm-hmm.
like the shoulder blade kind of area.
Yeah, yeah, absolutely. So interesting. Now, one other thing, you mentioned this a little bit earlier, the visceral manipulation type work. This is something that I actually was introduced to this concept I guess relatively recently, maybe a couple of years ago, that I hadn't been familiar with before. But now that I am, I'm always interested in learning more about it and how that works. I know I've talked to several people who have just had incredible results from doing that type of work. So I was wondering if you can share a little bit more about what that looks like and how that can really support people.
So with the visceral manipulation, you're getting into, so the abdomen is kind of a special area. So you have all the organs. There's some visceral fat around the organs. Then you have the muscle layer, fascia, and then adipose tissue. So getting into all of that and breaking it up helps to relieve a lot of pain, especially people that do have pain for an extended period of time tend to do shallow breaths from their chest,
Mhm.
take big belly breaths where they're really using their abdomen and expanding it and using it as it should be. So everything there in the core from the diaphragm down gets kind of tight. So you're getting in there and kind of releasing the tension. Also, people with bad cases or severe cases of endometriosis a lot of them will get either an exploratory laparotomy where they give that really unfortunate cut down the center of your abdomen, or even something that's done more laparoscopically. So they'll have an incision somewhere in their abdomen. Because of all the unique tissues going on in the abdomen, anytime you have an incision, scar tissue forms under the incision and then tends to like to latch on to other things. It's called forming adhesions. So it can latch on to your intestines, your bowels, other organs, which causes even more pain. So the visceral manipulation can get in there and break all of that up as well.
Yeah, which can be so powerful. I remember being shocked when I had a surgery about what was that, 3 years ago now, I believe. And I remember being told basically at coming out of that like, oh, basically all your organs are stuck together and or were stuck together in there. And I know that that's so common, but of course, going in and just having surgery when that kind of stuff comes up is not always a feasible solution. So it's nice to know that there's other options, and even like you said, post surgery. I think that's something that's really important to be aware of too. Maybe we can even dig into that a little bit more on the importance of getting support before, after that time. What are some of the things that you see can be really supportive for people, whether they're maybe getting ready to go in and have a surgery or they've already had a surgery? What are some of the things that you find to be really supportive in those cases?
So getting ready for surgery, I would say if you can just stretch and be as loose as you can be, that's always a good thing to help you, kind of help you like a prehab before the surgery.
Yeah.
Then after surgery, you definitely want to be aware of your activity restrictions. So anytime you get an abdominal surgery, you should try to avoid bending, lifting, and twisting. We call it BLT, like the sandwich in the world. And then there's definitely lifting restrictions. So don't go lifting anything even like 10 pounds because that puts a lot of pressure on the tissues that are very fragile at this point. Then, from what I hear, that the surgeons give very little education on the whole adhesion and scar tissue and managing
Yeah.
afterwards. So if you could go see a physical therapist about that after, you'll be much better off.
Yeah, yeah, absolutely agree with that. And I love that there's ways to support your body after that, to be able to kind of get back to feeling good in your body again, I think is so important. You mentioned also you were talking about the breathing piece of it, which I love me some breathing. I feel like I talk about breathing a lot, but it's so important. Actually, even as I was listening to you talk, I was reminding myself to sit here and take some nice deep belly breaths because it's easy to forget when you're in the midst of doing stuff throughout your day. But I would love if you can even share a little bit more about that, just how your breath really impacts your body, why it matters, the way that you breathe, maybe some techniques that people can use to help to support their bodies just with the breath. What would you recommend with that?
Yeah, so breathing is something that probably most of us definitely take advantage or take for granted.
Yeah.
So, like I referred to before, the sympathetic nervous system, when you're in a lot of pain or stressed, scared, anything like that, the sympathetic nervous system ramps up and that kind of puts your central nervous system on edge. So breathing is a great way to kind of calm everything down. It'll bring your sympathetic nervous system down. It'll relax your muscles, ease your pain. So to do that, you want to take deep breaths in through your abdomen. So you can put your hand on your belly, take a deep breath in through your nose. You want to make sure that your hand is rising farther than your chest so that you're filling your diaphragm with air and then blowing it slowly out through your mouth. And you can sit there and do that for 1 minute, 5 minutes, whatever you feel like you need. And you'll feel that your muscles start to just relax and you'll ease in general.
Yeah. Hey, my friend, I just wanted to take a moment to speak directly to the version of you who's maybe listening right now while unbuttoning your jeans because the bloating has already kicked in. If you're dealing with that swollen, painful, can't get comfortable kind of bloat, the kind that makes you feel like your body is working against you, or you're just tired of being bloated every single day and having no idea why, listen up because this is for you. I've created a brand new free live workshop called End the Endo Bloat because so many of us have been told to just cut out dairy or try probiotics, but that barely scratches the surface. In this workshop, I'm going to walk you through what's actually driving the bloating that comes with endo and what you can do to end the bloat once and for all and feel more like yourself again. If you're ready for some real answers and real relief, come join me. It's all happening on Monday, June 9th at 4:30 Pacific time or 7:30 Eastern time. It's totally free and there will be a replay if you can't make it live. Head on over to www.endobellygirl.com/bloat. That's www.endobellygirl.com/bloat, BLOAT, and I'll see you there. Now let's get back to the episode. Love that. Yeah, I absolutely agree. And, like I said, I love breath in general. Like I find it to be such a powerful tool. And I don't know if this is something that you've seen in your practice as well, that you've come across, but I find that when I am more focused on the deep breathing and the belly breath, and even things as simple as like before I eat a meal, I'll sit down and just take a few nice deep belly breaths to let those muscles kind of soften and relax. Cause I'm definitely guilty of, if I'm not thinking about it, I'm the kind of person I'll kind of hold on to tension in my abdomen. Just why literally as I'm talking to you right now, I'm like, okay, belly breaths, Alyssa. But I do find that it supports so many things. It's definitely, I think in the longer term, really helped to support with shifting things as far as pain. But I've also really seen a lot of support with helping with digestion, even helping with healthy bowel movements, helping with bloating, some of these things that had been previously a larger issue in my life that now I don't really notice. Not saying that the belly breathing is the only thing I've done to support that, but I do feel like it's been hugely helpful on the digestion side of things too. I was just curious if that's something that you've seen in your practice as well.
Definitely. So, constipation can have many different causes, but one cause is tight pelvic floor muscles.
Yeah.
So, to have a proper full bowel movement, you need to be able to relax your pelvic floor fully for the stool to come out. So if you're clenched up down there and unable to relax, it's going to be really hard to have a good bowel movement. So doing the deep breathing to relax those muscles can help to ease constipation as well.
Awesome. And for anyone who might not really be familiar with this whole idea, because it's, something, of course, you and I think about frequently, and I'm sure you talk about every day of your life, but I know that there's a certain percentage of the population out there who really isn't super aware of what your pelvic floor really is. Maybe we've heard that term, maybe you've heard little bits about it, but what does that really look like? What is your pelvic floor and how does that impact your body in general?
So, common to popular belief, everyone with a pelvis has a pelvic floor. So, that would include women, men, children, every human being has one. So, your pelvic floor is made up of a bunch of muscles that kind of act as like a hammock to hold up your pelvic organs. So, in females, that would be your uterus, your bladder, and your rectum. They also help to maintain continence, so make sure that you're not peeing, passing gas, or pooping when you don't want to. And then they play a role in sexual function as well. So it's a group of muscles that you normally don't really feel and you aren't really aware of. But if you have pelvic floor dysfunction, it will come up in a lot of areas in your life where it's not so great, like pain, constipation, incontinence, inability to pee.
Mm-hmm. Yeah, which are all important things. It's one of those you maybe don't recognize that you have issues until you start to have issues. And then you're like, okay, now I understand the role that my pelvic floor plays in my life. So as a pelvic floor PT, can you describe a little bit the type of work that you do? If somebody is having some pelvic floor dysfunction, what does that really look like in the way that you're supporting them? So if you had, say, a new patient coming into your practice who you were going to be working with, what would that really look like as far as that support?
So you want to make sure everything's working in conjunction together. So you go ahead, and the hips and the glutes and the core they're directly tied into the pelvic floor. So you test them, see if the length of the muscle is good, meaning if it's too tight, then it's not going to be working properly. Then you look at the strength, and then you can go internally into the pelvic floor. So in females, that would be through the vaginal canal, look at the innermost muscles, see if there's any pain or trigger points, see if there's any tightness, see if they're coordinated at all, and then see what the strength is. If it's too weak, that can lead to things like leaking. So then to address tightness, you would do a lot of stretching of the hips, the glutes, just the lower extremity in general, and then you start to strengthen. And then if the tightness is not there, but everything's too weak, then you just do strengthening of the hips, glutes, core, lower back, and that all works in conjunction to improve pelvic floor health. So Kegels are kind of outdated. I don't really use them in my practice very much.
Yeah. Yeah, I'm glad you brought that up because I feel like that's like the one thing people are most familiar with, but I have also come to recognize that that can actually be going the opposite direction for many people. Like if you have muscles that are already too tight and then you're doing, exercises to continue to strengthen those muscles, it can actually just be adding fuel to the fire. So, it's really, like you said, a matter of figuring out what's going on in your unique body. Are things too tight? Are things too, is there a weakness going on, and kind of finding that balance in your own body. Would you say that when you work with women with endometriosis, do you typically see more of the, tighter sort of muscles in the pelvic floor, or do you tend to see a little bit of both? Does it go both directions?
So I would say in most endometriosis patients that I've treated, there's all around tight pelvic floor muscles. But interestingly, tight muscles equal weak muscles. So think of your bicep. If you can straighten your arm all the way, you can bend over and pick up like a 25-pound weight with no issue. If you're starting like this and your arm's half bent, you don't have much leverage to pick things up. So you won't be able to bend over and pick up that 25-pound weight due to the lack of leverage. So then with a lot of people with tight pelvic floor muscles, they'll have stress incontinence because the muscles aren't able to absorb all the impact that's caused to the pelvic floor from like running, jumping, sneezing, coughing, that kind of thing. So they can have tight muscles and also be leaking.
Yeah. All the fun things going on, right? Yeah. And that's why I think it's so important to be working with somebody who understands all this stuff and can really, help you to pinpoint what's going on in your body. Because I know I feel like a common issue that I see, and I know I've been guilty of this kind of stuff myself, of just wanting to DIY it all and figure it out and, do a little Googling and figure out what I need to do to support my body. But, it's one of those things that sometimes it's just you need to go see somebody who really understands this stuff. Because, people like Danielle have spent many, many hours studying that pelvic floor and how it works and how all of those muscles and fascia fit together. And, that's oftentimes just the support that we need. So for somebody who, has endometriosis and, maybe is struggling with certain things and is kind of wondering like, oh, is this the kind of support that I might need for my own body? What do you feel like are some of, I know we kind of covered some of this already today, but what do you feel like are some of those common signs and symptoms that are showing that you might need to go in and get some pelvic floor type support?
So just the classic symptoms that you think of with endometriosis, a really painful period time. Just a lot of times you'll have pain elsewhere in the month too. If you're starting to have pain with working out, pain with sex, pain with inserting a tampon, if you're having leaking at all, then it's definitely time to go see someone because you can get that fixed and then save yourself a lot of suffering.
Yeah, absolutely. Totally. Okay. Thank you. Yeah, that's super helpful to just give, people some ideas on that. Now, of course,
Sorry. Oh, I left one thing out. If you're having a
oh,
lot of
sure.
constipation, then it would be a sign to go in
Oh,
and
yeah. Absolutely. Absolutely, which I know is very common as well. So, Danielle here is located in the San Diego area it was Rancho Bernardo, correct? Is where you're located?
yes.
And then weren't you getting ready to work with some people in other areas as well? I think you had mentioned that when we last talked.
Yeah, so I recently opened an office in Chula Vista, so
That's right.
South San Diego, and then I do virtual patient or virtual visits as well.
Oh, amazing. Awesome. Okay. So that's fantastic. If you're looking for this type of support, definitely reach out to Danielle. I'm sure she would be happy to help you or support you. Because I know my audience is kind of located in many different areas in the country and even in the world. If somebody is looking for pelvic floor PT in their area, say they did want to see somebody in person, how would you recommend that they go about finding somebody?
If they wanted to see someone in person elsewhere,
Yeah.
so a Google search goes a long way. So you could look them up on Google. You could also look up. So I would suggest looking them up on Google, then going to their Instagram. I know it's like a way, but kind of just look at their content and see what they're producing, just to see how legit they are. Then you can read
Sure.
there. There's also I think it's called the Global Pelvic Health Alliance. I believe that's what it's called. You can go on there and there's a directory that includes the US, and there's people listed state by state in there as well.
Oh, great. Awesome. And of course, you can always reach out to Danielle and she'll be happy to help you, whether in person or virtual, and be able to offer you that support as well. So thank you so much for sharing all of that. I think that's super helpful for people just to get a little more clarity on what this type of support looks like. I know I'm the kind of person too where like I might hear of something, but maybe not want to fully dive in if I don't understand what that kind of support looks like. I know that can sound a little intimidating for people sometimes, pelvic floor physical therapy. What is that? What does that mean? What does that entail? That sounds a little scary sometimes. So thank you for sharing all of that and just helping everybody to feel a little more connected with all of that and what that looks like and how that can support people. I really appreciate it. Is there anything else that you feel like you'd like to share with women with endometriosis that might be supportive today?
I think we did a pretty good job going over it. Just stretch, stretch, stretch. That's really going to help, which
Yeah,
probably could go for just about anyone.
that's true. Amen to that. That's why I am big into my yoga practice myself. I certainly feel a huge difference in my body when I am not, stretching and moving on a regular basis. So that's an excellent reminder. It's like anything, right? Going in to see a pelvic floor PT can be very supportive, but then in the grand scheme of things, it's all the things that you're doing on your own as well to support your body in between and before and after. It's the big picture support that you're doing in the long term that really, really starts to move the needle.
Yes, and I promise pelvic PT is not scary.
I know it's not. It's more I think the not knowing what's happening when you're going in. It's like anything, the fear of the unknown, but absolutely. And that's why we have practitioners like you who are so incredibly kind and supportive and understand what you're going through. And having that, I think, is incredibly supportive and makes the whole process just feel so easy and supportive for what's going on in your world. So thank you so much for what you do.
You're welcome.
All right. Well, I'm sure people are going to want to find you, connect with you, hang out with you. So I was wondering if you can share where the best places to find you are.
So you could find me on Instagram. My handle is Pelvitone. That's PELVITONE.physical.therapy. Or you could visit my website, which is pelvitonefromhome.com.
Love that. Amazing. And we'll be sure to share those links in the show notes as well. If you're like me and you like to listen while you're out driving or walking or any of the things. All right. Well, thank you so much for being here, Danielle. It was such a pleasure having you.
Thanks for having me.
Everyone, have a great day. Thank you so much for joining me today, my friend. If you loved what you heard, be sure to share with a friend and subscribe so that you can keep coming back for more. If you are ready to take the next step towards getting to the root cause of your endo symptoms like endobelly, pain, fatigue, and so much more, you need to download my free ultimate guide to building your own endometriosis diet. You can find the link in the show notes or at www.endobellygirl.com. Until next time, my friend.